I don't feel. What's that? What's that? What's that?
Hey, how's it going?
Actually, not too bad. How are you?
I'm okay. Yeah.
You excited?
Yeah, for sure.
Nice. I'm excited too.
Mm-hmm.
I'm just pulling up the script.
Okay.
It's 22 already. I'm a tab whore, and I'm very proud of it. I just don't like closing my tabs, but it does sometimes get in the way.
When you're trying to look for something.
Yeah.
That's real. That's very real.
Yeah. Let me see here. So Matt told me that he put your check in the mail today.
Okay,
Or will
sweet.
be tomorrow, so you'll have that soon.
Awesome.
Before I forget. And yeah, any questions? Anything?
No, everything's pretty good. I'm interested to see what your shirt says, actually. I can't see.
Oh, it says.
Not. I love it.
Actually, I need to change. I probably need to change my shirt.
No. I love it, but I guess you're at work, so I feel you.
Technically.
Fuck that. Whatever.
I know. I don't know if I told you, but I'm leaving Max full time. I just put my 2 weeks in last Friday. I'm very excited.
Yay.
It's something I should have done a while ago, but it's just life happens when it happens, right?
Yeah, for sure.
Yeah.
Are you on to bigger and better things?
I'm gonna. So my plan is to find a casual part-time nursing job to get back in the field and then figure out what I want to be in the spring. But I'll be doing what I think a lot of particularly Black queer people end up doing. Because I'm teaching at the college 1 day a week. I'll be at max 12 hours a week doing some support stuff. I'll still be doing K1. And then I really just want to work. I don't want to do anything more than part-time right now in nursing. So
yeah.
But yeah, that's it.
That's amazing. I feel like just the whisperings of your Instagram story indicated that you were not really happy where you were at. So I hope this is a good move for you.
Thanks. Yeah. I wanted to leave before it was not me. Like Max is great. Max is doing good work. Max has been good to me.
Yeah.
You know, and it was like, why am I, there's no reason for me to take my resentment out on this.
Yeah.
On this role. Plus comms, I don't know. I really want someone new to step into comms. Comms is exhausting. And like I just really want like some fresh eyes and some younger takes on social media. And like I'm done with that life.
Right.
So if you know anyone who I would love to have another Black and a racialized person take my job. So it's not posted yet. So if you know anyone who's comfortable with the umbrella of guys unto guys, however, would in any way, shape, or form, let them know. Get their resumes ready.
Will do.
Cool. So we'll start in 5.
Okay. Are you able to make me a co-host again?
Yes. And then, yeah. So when I had my screen, so what I need to do is, okay, hit that. Okay, so just make sure that was clicked. And then So I'll just share that I'll be monitoring, looking out for questions in the background. And if there aren't any, I'll just listen in and then we can discuss for a few seconds. Like I said, we don't have to go exactly till 8 o'clock. So just as long as I don't care about going over. I don't think we will, but
yeah,
8 o'clock, I'm shutting shit down.
That's gonna be my limit too. So it should be around like half an hour or so, maybe. Yeah.
Yeah. So like I said, it doesn't have to be anything exact. We're not modeling perfection. The only thing I'll ask, do you mind stopping to share your screen until when you start your presentation? That way when we go live on Facebook, we'll be good.
For sure.
Okay. I'm gonna be back in just a minute. Oh, I should take my do-rag off too. You'll also be there. So many reveals we've had to each other. We didn't talk for months, and now we're like, I quit my job. I also got my haircut today. So
hey, looking fresh.
I'm on the new things. That's that spiritual process to our hair.
Yeah, I feel you for sure. Congratulations, Robert Alsbury. The group you started to unite Black people of Ottawa has hit almost 1K members. It's the first thing I saw when I went on Facebook.
This is great. Just was so determined to find some Black people. I was like, where are the Black? And then they're here. We're out here.
Yeah, amazing.
Okay, cool. I'll be right back and then we'll start.
Yeah, no worries.
Hey.
Hey.
Ready? Shall we?
Yes, give me 2 seconds. I'm just going to pull something up here.
Okay. Where did this is where I went.
Perfect.
For your bio, do you want me to read the full thing or just summarize it quickly, or?
Summarize it quickly. If I really prefer you don't read it.
Okay, sounds good.
I could talk about myself. I just I'm like, my bios are so weird. So
that's first. I'll just say, joined tonight by Noah, who's presenting behind the scene, here to talk about gender-affirming access and gender care in Ottawa.
You could say things about me, but no worries about reading like the whole bio.
Yeah, like I'll let you, explain more about yourself or whatnot.
Yeah.
I'll just say Noah's very involved in a variety of work focused on LGBTQ and or Black and or trans and queer health. So that effect.
Sounds good.
Okay. And we're going to be late. It's not my fault, but that's okay.
All good.
I remember I did like a facilitation workshop at the beginning of COVID, like how to use Zoom in nonprofit, and it wasn't really that helpful, but what I remember the most is the person saying, we are not modeling perfection. We are just trying to create new ways of engagement during a crisis.
Yeah, I like that. We're not modeling perfection. It's important.
Okay, I'm going to hit go live.
Good.
And hello, everyone. I believe that we are live. Just waiting for some confirmation on Facebook's end. And yes, we are live. Forgive the delay. Hello, everyone. Thank you for joining us for Behind the Scene this evening. If we haven't met, my name is Robert. I use he, him pronouns. And on behalf of MAX Ottawa, once again, thank you for joining us. For those who are unfamiliar with Behind the Scene, this is a intermittently monthly program that Max presents with various speakers throughout the year. And I feel very fortunate to be spending some evening with Noah, who's our presenter, who has a great presentation planned for us. First and foremost, before we go any further, Max and myself want to recognize that the work that we do takes place on unceded and unsurrendered Algonquin Territory. And this is something that we always want to be mindful of, either as arrivalists or as settlers, our relationship with this land, how it impacts us and how it impacts the way that we treat other people. And particularly in a time of COVID with precarious housing issues, homelessness on the rise, mental health issues on the rise, it's even more so to be mindful of how these structures are negatively impacting our community, particularly our 2S LGBTQ plus family. So with that intention and with that purpose, I'm going to introduce to you tonight's subject, which is accessing gender-affirming care in Ottawa. And just some housekeeping notes is that this is a live presentation. It's Noah and I are the only ones in the room here on Zoom, but I'll be moderating in the background. So if folks have questions, feel free to drop them in our Facebook message or in the comments below in the live stream. We'll curate those at the end. And if there aren't any, which is okay, Noah and I will have a quick chat and we will wrap things up. This presentation is being recorded and it will be uploaded to YouTube for later viewing on our MAX Ottawa YouTube channel. Yeah. So as always, if you're familiar with me at Behind the Scene, you know that I do like to just share a few Max announcements at the beginning, so that way when we're done, we can wrap things up. So some of you have noticed, if you follow us on social media, that it is Mental Illness Awareness Week. So we've been sharing a lot of programs and services that we have designed to improve and maximize the health of guys and gals in the capital region. And for those not familiar, Mental Illness Week, which takes place October 5th to the 9th, is a little different from Mental Health Week, which takes place in May, and that it's meant to bring awareness to folks who are actually living with diagnoses such as depression, anxiety, bipolar disorder, and whatnot. And so whether or not we have wherever we're living in the spectrum of mental health, it's all important, and we need to work on breaking down the stigma and the barriers that we have and accessing what we need to take care of ourselves. So as such, we have our mental health navigation program, which is designed to help guys and gals find a suitable therapist in the Ottawa area. Spencer, who's our mental health and wellness coordinator, can help you get connected with that. We have a recently launched peer support program, which takes place twice a week on Mondays and Thursdays, where folks can call in and speak with a trained volunteer who will provide a listening ear and offer some support and possibly some resources if needed. We also have our newly launched Coaching with MAX program, which is designed to connect you with a peer coach. You'll work with them for 4 to 6 sessions, and it'll help you work with a specific goal that you're trying to reach. And lastly, what do we have? And just wanted to share very briefly is that we do have a really great partnership with the Ottawa Senior Pride Network with our LGBTQ tablet lending program. So for seniors in the area who want to feel more connected during this time of social distancing and may not have access to a computer, Ottawa Senior Pride and MAX has tablets that you can come and rent. You can also get assistance with learning how to use them so that more people can get access to spaces such as we're now in a digital age. So enough about me, enough about Max. Let's move on to Noah. Who is a really incredible speaker. I had the wonderful opportunity of being in space with him last week during Keeping It 100, and we had a similar discussion, but today we're bringing this discussion to a wider audience. Noah is born and raised in the Ottawa area and has been greatly involved with a lot of LGBTQ plus and or Black and or queer work, including their professional work now, and really excited about their presentation. And that's it. So I'm going to go away. Noah, you have the stage, and I'll see you when you're all done, and hopefully we'll have some questions from the audience.
Sounds good. Thank you, Robert, for the wonderful introduction. Thank you all, MAX Ottawa, and for having me on BTS today. Like Robert mentioned, my name is Noah. I use he and they pronouns. I am the community support worker in the trans health program at the Centertown Community Health Center. So oftentimes folks who are interested in pursuing affirming their gender through medical transition often reach out to me as a first starting point to start exploring options and what's available in terms of trans healthcare in Ottawa. So this presentation today will be focused on what's available in terms of transgender healthcare in Ottawa, and the best ways to connect to services and sort of how our clinic functions and how it works. I will have my contact information and ways to reach out to me if you are interested in accessing our services throughout the presentation, so that information will be there. Robert, I assume that you will let me know if there's any questions as we go along. I'm happy to answer them as we go, no problem at all.
Yeah, for sure. Actually, I'm going to just interrupt for 1 second and forgive me because I got a note that someone couldn't hear us. So I just want to make sure before we go any further.
Okay.
That's resolved.
Okay.
Noah, do you mind just saying something very quickly?
Test, test, test. Test.
Okay, so I have audio on my end, so it may have just been an issue with that person's computer. So forgive the interruption, and we will continue.
No worries at all. All right. I like to work off of this presentation just because I'm all about accessibility. So for anybody who's a visual person and wants to see some of the things that I will be talking about and sharing, that's the purpose for this presentation. So follow along as you would like. But again, here's all my contact information. So if you want to capture it, I'll put it back on display at the end. But if you want to reach me for services, related to like transitioning and gender and things of that nature, you could always reach out to me by phone or email. I would be happy to support you. So a little bit about the program at the Centertown Community Health Center. The Trans Health Clinic was established in 2016 to provide healthcare to trans and gender diverse folks in the Champlain region. So in 2020, we still do exclusively serve those in the Champlain region. So what the Champlain region is, it's Ottawa and the surrounding areas. So this goes as far as Cornwall, Deep River, Rockland, a lot of like the more rural places or suburbs that exist in Ottawa, we're also the go-to folks for folks to access trans-affirming care through. It's sort of a bit unfortunate. That's a really wide area that we're covering, which can lead to like really long wait times and things feeling stretched a bit. But I'm also glad that we exist as a service for folks in the surrounding areas as well. At the end of 2019, we received permanent funding, which allowed us to sort of shift and change our model a lot. So what this looked like is we got more funding to add an additional doctor to our clinic to be able to work on our wait times and provide services to more people. We also created the new role, which is the program lead, so the manager of the clinic to oversee things. And my role as a community support worker moved from a part-time role to a full-time role to be able to support folks better. In terms of the folks that would be on the team in the clinic, again, community support worker, which is myself. There are 2 doctors, 1 nurse practitioner, 2 to 3 nurses, 2 to 3 mental health counselors, and a program lead. So throughout this team, there are 3 people who identify as transgender and also working in the clinic as well. And we like to share that as it's really helpful to know that sometimes when you access services specific to being trans or gender diverse, you're met with potentially cisgender service providers who might not be knowledgeable or coming from places of privilege and intentionally or unintentionally can cause harm. But we're on the team to sort of mitigate those things and make sure that our cisgender providers are sort of up to speed on best practices and to make sure that everybody feels affirmed and welcome when accessing services. So what we offer hormone initiation, surgical assessments, counseling, health system navigation, and online educational support sessions. So in terms of hormone initiation, what this is basically for anybody who's interested in pursuing medical transition, so starting hormone therapy in order to either feminize or masculinize themselves to sort of affirm their gender more. We do offer that service. Our Hormone Start clinic functions twice a week. So we go all day on Wednesdays and then all day on Fridays. We operate under informed consent, which is sort of the new best practice for prescribing hormone therapy and providing trans healthcare in general. For folks who don't know what informed consent is, I'll go into a bit more detail around what that is. But basically, in a nutshell, the old model was in order to get hormone therapy, you would have to go potentially see a therapist and have that therapist confirm that you have gender dysphoria, and then you would be a good candidate for hormone therapy. And so that came off as really like gatekeepy, sort of like we have the hormones and you have to go through all these pathologizing processes in order to access them. So based on community feedback, we now operate on informed consent. So as long as you have all of the information risks, benefits, and things like that that come with starting hormone therapy, and you're okay with taking those risks and knowing what those benefits are, then we sort of trust your word and move forward however you would like. We also offer self-injection teaching. So anybody who's taking hormones through not intravenously, but through syringe, so a needle. We offer service one-on-one time with a nurse, where the nurse would teach you how to inject yourself with your hormones, and practice with you and basically support you through it until you're comfortable self-injecting at home by yourself. This self-injection service is mainly for folks who are currently in our clinic, but there are circumstances under which, when things are happening, we're able to support as well sometimes. Surgical assessments, again, is something we help with. We do surgical assessments 3.5 days a month. So there's one afternoon in the month. It's usually the last Wednesday of every month, where our nurse practitioner does assessments for folks who want to access top surgery or bottom surgery. And then we have other slots with a counselor, a registered social worker, for anybody who needs a second assessment in order to access gender-affirming surgery. If you're wondering what surgical assessments are and you're confused by what I'm saying, I'll go into gender-affirming surgeries a bit later and give some brief information about that. We do offer counseling as well. It's short-term counseling. The counseling is mainly focused on gender dysphoria, gender transition, and mostly issues related to being at any point in your transition. Usually, like I said, 6 to 8 sessions. Right now, during the pandemic, it's happening over Zoom. Or if Zoom is not comfortable for you, counselors would be able to meet you through the phone as well. There is no charge for these services as well. I offer health system navigation. So big part of my role is helping folks find doctors who are trans affirming, who are gender affirming. There are not many doctors. If folks are wondering if I'm aware of any doctors who are accepting patients right now, if you reach out to me, I'd be able to sort of reach out to my networks and see, but it's one of the challenges of my role is finding doctors in Ottawa who provide trans-affirming healthcare and are not sort of frightened by the idea of their patient going on hormone therapy and having to care for them in that way. So in addition to like helping folks find healthcare, I also help folks with like navigating different processes that might be related to being trans and gender diverse, specifically changing your name legally and the process that comes with that, changing the gender markers on your ID, and just access to like different social supports and things like that. So like where to get a binder, where to get electrolysis or laser hair removal or permanent hair removal, talking through options for surgeons, things like that. I would say like there's nothing that I will sort of like turn somebody away for. I really do try my best to, if somebody comes to me with a concern or question or an issue, I try my best to sort of support them and advocate for them how I can. And then lastly, we do offer over the summer, I think starting in April, as COVID sort of started to hit really badly, we realized that we don't want to lose connection with community or the folks who are in our clinic. So we started facilitating sessions twice a month over Zoom. These were group sessions consisting only of trans and gender diverse folks, mostly folks who are accessing services at our clinic. And again, mostly educational based and we focused on accessing gender affirming surgeries, changing your name and gender markers legally, sexual health, advocating for yourself in the healthcare system, transitioning at school and university. Currently, that is on hold, and we're currently looking at revamping a support group for folks who are at different journeys in their transition. So that's what we're working on right now. So stay tuned for more information on that. In terms of what somebody's journey looks like through the clinic, it's really laid out really well here. So this is what your journey might look like if you were to come through Centertown, or if anybody were to come through Centertown to start hormones. So your first stop in the journey would be an intake with me. So I am also the intake worker, in charge of sort of introducing folks to the program, hearing a bit about their journey in terms of their gender, connecting them to supports and resources, and adding them to their wait list. That's all me. So during that intake, I would gather information about your transition goals, again, provide resources and supports if that's something that you need. I try to make the intakes really comfortable, really accessible, really like low barrier, as I'm really cognizant of the fact that some of these issues that folks are coming to me with initially, like they might not have discussed widely with a lot of folks. So I completely want to acknowledge and understand. I can sort of like imagine with my own lived experience as well, talking to somebody about something that can be so personal, and you don't know that person. So I try to make them really pretty chill as much as I can. I ask a lot of questions, but I also give room for if folks want to pass on a question, I sort of implement something that they can just say a word and I'll just move on from there. So I try to make things pretty accessible. After an intake with me, the end result can be that folks are added to a wait list. This wait list is to actually start hormones through our clinic. Our wait list is currently, as you see captured here, 6 to 7 months. I would say that because of the pandemic, it's closer to 7 months, just because we had to sort of adjust the way we provide services. If folks want to move faster than the 7 months, during that initial intake meeting, I would talk about what your options are. As we're not the only ones able to prescribe hormone therapy in Ottawa, there are doctors and endocrinologists who can do the same things that we do, maybe a bit less wraparound support, but you would still get hormones. And usually the wait time for those doctors is around a month to 2.5 months. So depending how fast or slow folks want to move, I try my best to sort of use the resources that I know of to connect folks as soon as possible, if that's something that they want. So after you wait 7 months on our wait list, I would reach out to you, as that would be the time when your name would come up next on our wait list. And I would, if at that point, when I reach out to you after an intake, it's not a matter of, okay, we have appointments for you to start hormones, here they are, let's go. I more so call and see what's changed over 7 months. I sort of inquire whether folks feel comfortable and in a good place to actually start hormone therapy. And so if folks are ready, then I can give appointments right then and there. If folks are not so comfortable after the 7 months of waiting and they still need a bit more time to figure things out, your place will be held on our wait list until you're sort of ready to get started. I will say that after you wait 7 months, you're not going to have to wait much longer after that to start hormones. As you see on this chart here, after the 7-month wait, you get your initial appointments. And after your first appointment with us, usually on your second visit is when you would start hormones. So during your first visit, it's just more so a nurse and the doctor who would actually be prescribing your hormones, getting to know you a bit better. So they would collect your medical and social history, your vitals and your measurements. So your blood pressure, your height, your weight, your BMI, your chest circumference, and any information about medications you take, or any like health issues that you might have. It's important to go through this information because there are some very unique circumstances under which if somebody were to take hormone therapy, it can be a major risk to their healthcare. So going through the health history helps the doctor know what's going on for you and things that need to be considered when prescribing you hormones. Between your first and second visit, you would get some blood work done. And then the doctor would give you the requisition and organize for you to get that done during your first appointment, so you can get it done before your second appointment. So during your second appointment, they review your blood work. And if everything like checks out fine on your blood work and there are no unique circumstances that would cause you to delay getting hormones any further, usually that's when, like I mentioned, you would start hormones. For people who are masculinizing, so people who are going to start taking testosterone, you would usually get a shot right there and then during that second appointment from the testosterone stock we have in our clinic. For anybody who's feminizing, you would start on an anti-androgen or a hormone blocker for the first couple of months before estrogen is then implemented. Your visits after the second one are just monitoring you, assessing you, making sure that things are in line with your goals, adjusting your medication, as you would like, and things like that. During your third and fourth and plus visits as well, this is the time when we would do any assessments that you are requesting for surgeries. So I might have briefly mentioned before, there are some gender affirming surgeries that are covered under OHIP. So we would do the assessments required for you to get those surgeries covered under OHIP, if that's something that you want. The doctors or nurse practitioners who are working with you would provide you any letters that you would need to change your gender markers legally through Service Ontario. So different things like that we would be able to assist you with. And so we're not like a permanent clinic for folks. So eventually, as you see here, we discharge folks from our clinic. And we discharge folks from our clinic because if we were to see folks ongoing, then there would basically be no availability to see people who are now waiting on our wait list to start services. So we try to help as much folks as we can, which is why we have to eventually, when people are stable, comfortable on hormones, and they have another doctor who can maintain what we've started, we send folks off kindly. When anybody is discharged from our clinic, we do a general check-in first. We make sure that everything's good, everything's feeling good, the dose is comfortable, things like that. And then if folks happen to have a family doctor and they're comfortable with their family doctor taking over care moving forward, we send the family doctor a package related to trans healthcare. So what the prescription is, when to monitor blood work, how to read blood work, how to do dose adjustments, and an offer to the doctor and the patient to then consult. So we're aware that trans healthcare is new for a lot of doctors. And so we like to make ourselves available for anybody who we discharge to if that doctor needs a bit of support in monitoring the hormones and maintaining them. And that means that doctor could potentially help other patients that are also potentially going to be on their roster in the future. I think that would be better for everybody. So we try our best to work with doctors and increase their capacity to provide this care on their own as well. So that's sort of just basically a flow of what the time would look like in our clinic. Are there any questions so far, Robert?
None so far, but
Okay.
we will monitor, and please don't be shy. Just place them in the comments.
Yes.
Or send Max a message and we'll be happy to answer those.
Yes. Happy to answer any questions as I go along. So please ask if you do have them. Okay, so a bit about informed consent, like I talked about before. So in an informed consent model, you get to make decisions about your treatment, and your provider's responsibility is to make sure you know what to expect from hormone therapy, including the physical and emotional changes, side effects, and potential risks. The provider will guide you in this discussion by asking you about your health and transition goals and explaining any risks. So all to say that I really start this process at the intake by going over the effects and the time course of hormone therapy, which I'll go over in just a second. And then again, the doctors might go over it briefly with you when you're actually being seen in our clinic now to start hormones. And this is what informed consent is, just making sure that folks are aware of what they're getting into and if they're okay with it moving forward and proceeding. And that really puts the agency and the trust back into folks and trusting that folks know what's best for them. And so that's the best practice, and that's sort of like how we navigate that's how we sort of like navigate connecting people with hormone therapy is through informed consent. There are still doctors and endocrinologists in Ottawa who operate on the hormone readiness model, again, which is sort of opposite to informed consent, where you have to go through a lot of professionals that can cost a lot of money in order to confirm that you are actually transgender and then be able to get hormones. So this is best practice moving forward. Folks, let me know if you have any questions about informed consent. In terms of, again, just going over briefly what hormone therapy is actually like. The way we sort of discuss and have conversations around hormone therapy, depending on what direction somebody is going, we define it as masculinizing. So anybody who would like to take testosterone, we define that as masculinizing. And anybody who's hoping to take estrogen or hormone blockers, we consider that feminizing. So very aware that this is sort of like another gendering of, like another binary of way of looking at things. But in terms of like the healthcare profession, this was using masculinizing and feminizing was their way to sort of lean away from using terms like MTF, male to female, and female to male, which can feel very black and white, whereas masculinizing just speaks to sort of the direction that you would be going in, type thing. So on the screen displayed here is just what the effects in the time course of a regimen of an anti-androgen and estrogen would be. So like I mentioned, anybody who's feminizing, usually the first couple of months of your start to hormone therapy would start with a hormone blocker. So anybody who's assigned male at birth and has gone through puberty, so past the age of like 16, 17 usually, there's enough testosterone in your body that means that if you were to implement estrogen, the estrogen would sort of like convert back into testosterone and be virtually useless. Most likely do the opposite of what your goals might be for yourself. So with the hormone blocker or anti-androgen, the goal is to suppress the testosterone in your system. So those testosterone levels usually get suppressed. The doctor would want to suppress it to what a cisgender woman might have in their body. So everybody has testosterone. Again, people assigned male at birth have a bit more after going through puberty. People who were assigned female at birth and that still fits with them and they identify as cisgender women also have minimal levels of testosterone in their body. So the goal is to get those testosterone levels down minimal to very minimal levels. So then estrogens can sort of take over and be the dominant hormone inside of your body. And estrogen is the hormone that leads to a lot of the feminizing. Some things to note around the changes that come with hormones. So there's things that are irreversible, reversible, and variable. The two documented things for folks who are feminizing that are irreversible is breast growth. Breast growth usually starts to happen 3 to 6 months into hormone therapy. Some people don't experience breast growth. Maybe they just experience like a bit of sensitivity or tenderness around the breast area. Some people do experience breast growth. It's hard to say what it might look like for everybody. But one sort of, maybe I'll talk about that a bit later. The other sort of thing that's potentially irreversible is around fertility. So starting with the hormone blocker, what happens is it decreases a lot of testicular volume and sperm production. And so starting off with the blocker, it could potentially make somebody infertile. And so for anybody who's feminizing and assigned male at birth, if this is a concern, like banking sperm through the Ottawa Fertility Clinic is a great option. That process is covered under OHIP. The only costs that are associated with fertility preservation, specifically sperm banking, is about a $400 to $500 a year fee to store your specimen in their freezer. So again, happy to walk anybody through those options if you want to reach out to me and talk more about your specific circumstances. Some things that feminizing hormone therapy does not do, it does not affect height, so it does not make anybody taller or shorter. It does not affect the depth or the height of your voice. So it will not make your voice deeper or it will not make your voice higher either. And it does not have much effect on your bone structure. So like in terms of like your skeletal makeup, that won't change significantly while being on hormones. Although a variable effect of feminizing hormone therapy is fat redistribution. So hormones are said, depending on somebody's genetic makeup and how their body responds to hormone therapy, the hormones are said to sort of redistribute the fat on your body to create a more curvy figure. So the fat is, you can see on this diagram, there's this little orange marking near the thighs. So the fat will start to collect there a bit more, as opposed to folks who are assigned male at birth and have gone through puberty and things like that. Fat usually starts to collect around the lower body. So like the abdomen and the lower back, so that will move down to the thighs, the hips, the bottom potentially. Another thing that feminizing hormone therapy will do, puts a stop to baldness. So some folks who have reached their 20s or 30s, depending on your genetics, might experience a bit of balding to like their temples or the middle of their head or their hairline. So hormones will sort of like put a stop to that. If you've already experienced loss from this effect, hormones won't really allow for more hair to grow back. Although some people have told me otherwise, I'm not too sure if there's other things at play. But you won't lose any more hair after being on hormones. In terms of masculinizing hormone therapy, it's sort of, there's a few things to think about as well. So just to circle back quickly to feminizing hormone therapy in terms of how you would take your medication, most folks take both their hormone blocker, anti-androgen, and estrogen orally. But there are also the options of estrogen patches and estrogen injections, depending on your circumstances and where you're at. But the go-to methods of prescriptions for most providers is oral estrogen and oral hormone blockers. Although there are alternatives to estrogen, which I mentioned, there are really no alternatives to hormone blockers. I only know them to come in pill form, but they're very, very, very tiny pills, and you usually just take half of that pill maybe every 2 days. For anybody who's masculinizing, in terms of your options of actually putting the testosterone in your body, as I'm sure many folks know, injections are the most go-to way. I specifically seen a lot of people on YouTube giving themselves intramuscular injections. So that's injections into your thigh. Another alternative to that, which is our go-to method, is subcutaneous injections. So what that means is it's an injection a couple of inches away from your belly button in the fat in your abdomen. We teach that way because we find that the needle, you can use a much smaller needle to inject yourself when you do subcutaneous. And it's just also easier to sort of like teach somebody the areas to focus on and how to do it. We're aware that folks have needle phobia, and injections are not going to be the go-to for everybody. So alternatives to testosterone injections are a testosterone patch. So similar to when somebody would want to like stop smoking, they would wear a patch with nicotine in it. So a similar patch exists, but instead of nicotine, there's testosterone in it. So you'd wear it on your skin. It's a very good alternative to the injections. I guess the only con that I've heard about the patch is that it can cause skin irritation and skin rashes. I've known a few folks to break into some pretty bad rashes on their skin. So if you have a tendency to break out into rashes, or you have really sensitive skin in general, it's not a great alternative. An alternative to the patch is testosterone gel. So they either come in like a bottle that you pump into your hand or little sachets. So you would either be prescribed a certain amount of sachets, or you would be prescribed a certain amount of pumps a day. So you pump it into your hand, you rub it on your certain area of your skin, and it sort of seeps through your skin. Testosterone gel it's called Androderm usually. It's the most expensive way to sort of implement testosterone. It's also transferable to others. So if you were applying your T-gel and you did not let it dry and you were to touch somebody else, that gel would transfer over into the other person's body as well. And so it's really important to sort of like rub it on and let it dry before you touch anybody or anything. So I've heard it's not really a great option for folks who are like living in close quarters with people or very touchy feely, because not everybody desires the effects of the tea. A couple of notes about the effects around testosterone. It does not affect your height again. It does not make you taller or shorter. It does not affect your bone structure either, although sort of like does the opposite than feminizing hormones. So for anybody assigned female at birth, the fat that usually collects around your thighs, your hips, and your bottom, that will start to move up into your lower back and your abdomen. So you'll have less of a curvy figure, or what some would consider like a bit of a feminine figure. For some people, your menstrual cycle will stop. I would say for most people it does, but it really depends on your dose. So for people who are on a lower dose, the menstrual cycle is supposed to stop 2 to 6 months into hormone therapy, but it doesn't always. So if you're on a lower dose, it can take longer to actually go away completely. If you're on a really high dose, I've seen people take their first shot of testosterone and never see a period again. So it really just depends on your circumstances as well. Yeah, I think that's all I will say in terms of masculinizing hormones. I'll just move on now quickly to talk about some of like the medication. So in terms of like feminizing hormone therapy, these are the options for the blockers like that I mentioned. So the anti-androgen, spironolactone and cyproterone are what we prescribe. They're both very different, have very different side effects and risks depending on your health history as well. So I encourage you, if this is something that you're interested in pursuing, to research these two medications just to see how you feel about them. And on the right here, you can see sort of the average costs for like a month's worth of medication. But for anybody who's 25 or under, hormone therapy is covered under OHIP Plus, so you would not have to worry about paying out of pocket. For anybody who is on Ontario Works or Ontario Disability Support Program, it can also be covered through the Ontario drug benefit, Trillium drug benefit as well. For folks who don't have any of those means for coverage, I have not seen anybody's insurance reject them covering their hormones before it is a medication, so I don't see why it would be an issue. And again, these are sort of the costs associated with estrogen. So there's oral estrogen, the patch I was mentioning, and the injection, estrogen through injections. So the costs are all broken down over here. Let me just see. Yeah, so in terms of testosterone, so there's two different formulations of injectable testosterone. There's depot testosterone, and there's testosterone cypionate. So depot testosterone is the first one captured here. And testosterone cypionate is the second one captured here. So these would be your options for injectable testosterone and how much it costs. Again, covered under OHIP Plus if you're 25 or younger, but covered under Trillium drug benefit if you're on Ontario Works or ODSP, and also covered under work drug benefits programs as well. And you can see the cost for the patch here as well. You could see the alternatives for testosterone are a bit pricey, but they're still sort of like doable as well, depending on your circumstances. Okay, so now I'm just gonna briefly talk on surgeries. So like I mentioned briefly, there are surgeries that are covered under OHIP. So if folks are considering any surgeries to sort of affirm their gender a bit more medically, these would be available to you through OHIP. So there's a few sort of caveats to that I want to let folks know about. So I'll start with sort of like the upper body surgeries. So for anybody who's masculinizing and wants to pursue top surgery, basically what top surgery is the removal of breasts. So another name for this is a mastectomy. Mastectomy is covered under OHIP, but the only thing is that most surgeons in Ontario will do your mastectomy, so they will remove the breasts, or they'll sort of remove the chest, but they will not sculpt your chest or contour your chest to sort of be more presentable and more to masculinize the chest, to make it look like if you were to wear not wear a top, it sort of looks like a quote unquote regular chest. They charge extra for that service. So surgeons in Ontario charge, the lowest I've seen somebody charge is $1,000 and the highest is $6,000. So it sort of varies. The only place that does mastectomy and chest sculpting and contouring, all with the fees that OHIP would provide, is GRS Montreal. It's a gender surgery clinic in Montreal, where gender surgeries first started sort of rolling out in Canada. And so they're the only folks who would do top surgery, all covered by OHIP. The last thing I'll say about top surgery is anybody who has a high BMI. So what BMI is your body mass index. It basically is a way for medical professionals to sort of track obesity. It's considered fat phobic in some ways, and I would agree with those criticisms as well. But for anybody who has a BMI over 35, so basically anybody who would be considered medically obese or be considered to a medical provider to be heavier or larger, or on the bigger side, for lack of better terms, so top surgery is much more harder to access. So there's one surgeon in Ottawa and one surgeon in Toronto who do not have BMI restrictions. But the one surgeon in Ottawa who does not have BMI restrictions will charge you over $6,000. If you are what they consider a larger person, they will charge you somewhere close to $6,000 to sort of sculpt your chest and masculinize your chest. And they say they do that because the more work they have to do, the more they charge. So it's not right, it's shitty. There's some advocacy sort of going on, to have that changed. But the reason why it's sort of that fat phobia is very present is because a lot of for top surgery, you have to go under anesthesia. And for anybody who is at risk of succumbing to sleep apnea or being affected by anesthesia in a way that might lead to them not waking up is a major risk for a health professional, and they decide not to take that risk to operate on folks. For feminizing top surgery, this would sort of be a breast augmentation, so adding sort of breast implants. That is covered under OHIP, but there's a huge caveat to that. So the only circumstances under which you can get a breast augmentation that's covered under OHIP for the purposes of affirming your gender is if you've been on hormones for at least a year and you experience absolutely no breast growth as a result of the hormones. OHIP will consider that the hormones were not effective for you, and then they will cover your surgery thereafter. The only way to sort of measure, sort of prove this to OHIP is before you start hormones, you'd measure your chest to sort of see what your chest measurement is before you start hormones. And then if you're noticing no changes are happening, you measure your chest again a year after being on hormones. And if the measurement sort of is the same as the year before, then that would be OHIP's proof that that would be proof that you can bring to OHIP to sort of cover you for that surgery. But even if it's you have minimal growth, just maybe a couple of inches, that measurement is different, then OHIP considers the surgery cosmetic and will not cover it at all. In terms of bottom surgery, those are covered under OHIP as well. So an orchiectomy is basically for folks who are feminizing. It's the removal of the testicles. And for folks who are masculinizing, an oophorectomy is sort of the removal of the ovaries. There's also external genital surgeries that you can get. So for folks who are feminizing, vaginoplasty. So this is sort of creation of the creation of a vagina and a clitoris and things like that. And for folks who are masculinizing, there's different options for bottom surgeries. For example, metoidioplasty. This is basically while being on T, you might experience some growth to the clitoris. So what happens is sort of like they work with that growth and sort of create a phallus or a penis with that. But there's also like phalloplasty as well, where they would just sort of use skin grafts from different areas of your body to create a phallus or a penis. So that's sort of gender surgeries in a nutshell. For top surgery, you only need one person to assess you. This person has to be a nurse practitioner or a doctor. What an assessment looks like is sort of like they'll just like go through your history and how you feel about your chest, sort of try to prove that you're a good candidate for the surgery through proving that you've had gender dysphoria, and this is something that is very uncomfortable for you to live with. Once they complete your assessment, they send a form and a letter to the Ministry of Health, and then the Ministry of Health will process your application, send you a letter back, and then that's when sort of consultations and things like that would start with surgeons. In terms of accessing any services through our clinic, you can self-refer. So you can self-refer by sending an email to transhealth@centertownchc.org. That email only reaches me and the Trans Health Program Lead. His name is Alex. You could also self-refer by calling my office line, and it's captured on the screen there. If folks don't want to self-refer and you want to have a doctor refer you, a worker, somebody supportive refer you, we do take referrals from third parties. So somebody can reach out on somebody's behalf through email or phone as well. But if you're working with any medical providers who are still using fax, folks can have their doctors or whoever is caring for them send a fax to the number on the screen, and I would reach out to folks directly to sort of schedule some initial time to meet. Like I mentioned briefly before, we're not the only people in Ottawa who provide hormone therapy or services related to assessments for gender-affirming surgeries. There are endocrinologists in Ottawa who do this. They're great options for people who would not really feel like they would benefit from the wraparound care that Centertown Community Health Center would offer, but are sort of in a place where you're more stable, comfortable, and you really don't want to have any more conversations about this. You want to sort of go head first and just start hormones as soon as you can. Endocrinology is a great option. So if this is you and you want access to a certain like suggestion for an endocrinologist, I don't have permission to sort of advertise their information and their names. But if you reach out to me, I will give you my suggestion for endocrinologist, and I'd be happy to advocate with you and support you in you seeing an endocrinologist. Most endocrinologists require a referral from a doctor or nurse practitioner. So if you have a family doctor or a nurse practitioner who you see regularly and they're able to refer you, that would be your best bet. But for anybody without a family doctor, or for anybody who's not comfortable going to their family doctor to discuss gender or transitioning yet, this can also be done through a walk-in clinic. So for folks without a family doctor, walk-in clinics are great. But if you have a family doctor and you want to access a walk-in clinic, there is a chance that the walk-in clinic or the doctor that the walk-in clinic refers for you might sort of like let your doctor in on what's going on, as it might be captured in your health record. Yeah, so if folks want more information, please reach out. I'm nearing the end of the presentation. Do folks have any questions?
No questions, but we do have a comment that says, "This is wonderful. Fortunately, someone had to go into another meeting, but they're lucky to have someone as wonderful and informed as Noah with us."
Oh, that's sweet. Thanks, y'all. But yeah, thank you, BTS and Robert, for this platform to sort of let this information exist, widely in Ottawa. Anybody who's interested in more information or wants to talk one-on-one with me, more about services, or for you or for anybody who you're connected with, please reach out to me. I would be happy to support.
Great. Thank you so much, Noah. And I'll ask you, because I realized I forgot to do this in my introduction as well. If folks did want to reach out to you in regards to the information you presented tonight, where can they find you?
They can find me. Did you want me to just share my email?
Whatever's
Yeah. Okay. Yeah. So yeah,
whatever would be best.
for sure. So the best way to reach me, like I mentioned, is transhealth@centertownchc.org. So if you just send an email there, it will reach me directly, and I'd be able to support, no problem. If emailing is not for you, you can give me a call on my office line. Maybe I'll send you that information, Robert, so you can share it with folks.
Yeah, for sure. And folks
Okay.
can certainly look, Centertown website will have all those details as well. So
Yes, exactly.
yeah, wonderful. Thanks so much.
Of course.
I did just have a quick question, and taking everything in, and obviously, this process, these processes may not be as smooth as presented. And so as folks are waiting, and obviously there's a lot of patients involved, what type of support or suggestions do you offer or suggest to folks as you're going through this system?
Yeah, of course. So usually folks who opt to sort of like wait for our services for 7 months, I usually try to stay connected with folks. So I do offer up some services like I can assist with changing your name legally. I can an assistant in connecting you to some like social support resources, like what's available in terms of removing your hair permanently, buying a binder, things like that. I try to support with. I try to do a bit of peer support as well, as I'm coming from my own lived experience being on testosterone. So answering any questions and concerns, and related to moving forward with this journey. I'm also pretty well versed and educated and connected in terms of feminizing hormone therapy, although I don't have the lived experience with it. Talking to folks and sort of providing a bit of peer support that way as well. In terms of like other services and things like that, one thing I like to share with everybody, it's called the Champagne Region Health Gender Diverse Guide. I might have reversed some of those words, but basically, basically it's a guide, and I think it's even on the MAX Ottawa site if I'm not mistaken. But it is a guide that sort of captures all of the supports and the resources that are available for anybody who's sort of like going through transition. So there's support for yourself, there's support for your family members, and parents, because sometimes those can sort of be a bit of an issue. So I like to share that gender resource guide because folks can always reach out to different parties in community, like Max Ottawa as well. I like to talk about T for T zone where it's relevant. But yeah, I like to provide that guide, and for folks looking for like group support and things like that, I talk a lot about Gender Quest at Kindspace, as I know that's a really great support group that's currently happening over Zoom for folks who are at any stage of their transition. So we also have a private invite-only group that we run. So if that's something that you want to be added to, you can reach out to me. So yeah, if whatever folks sort of want support around, I offer some things, but I also work with folks and meet them where they're at with whatever they need support around. And there's some folks who really don't want to have any more conversations about hormones or their story or their journeys because it's just shared too much. So I leave it in folks' hands, and if they want to work with me closely in the 7 months they're waiting, that's an option. Most people opt to just wait and reach out to me to know, hey, Noah, have I moved up on the wait list? And yeah, I'm happy to share where we like to be very transparent. So if you ever want to know where you're on the wait list, yeah, I'm always happy to share that as well.
Wonderful. Well, I think that's time. Thank you so much again for a very thorough, informative presentation. I certainly learned a lot from all perspectives as a healthcare worker, as a Max employee, as a cis person. And it's really great to know that there's such great resources and connections for folks who are going on their gender journey and making it their own and feeling supported.
Yeah.
I mean, I'm sure that as I feel, it can be difficult to feel like there's information out there, that there's resources out there, but there certainly are. And I hope that this presentation can add to that.
For sure.
Great.
Yeah,
Well,
thanks for having me.
The pleasure is ours and mine. I can't get enough of I can't wait till we're together again.
Yes.
So that being said, folks, like I said, this will be downloaded and uploaded to YouTube. Please feel free to share and enjoy for your own informative purposes. If you do have any questions about the presentation, don't hesitate to reach out to MAX Ottawa, info@maxottawa.ca. We'll be happy to put you in touch with Centertown and NOAA if that is appropriate for you. We are planning our next behind the scenes for the year. We'll probably do 1 or 2 more before 22 is over. But just make sure to follow us on Facebook, Instagram, and Twitter, and you will see the upcoming dates for the program. So with that being said, Noah, thank you again. Have a good night.
Of course. Have a good night, everybody. Bye.
All righty. Take care.
See ya.